September 11, 2001, we have deployed into the war zone almost 3 million Americans. And we've exacted a heavy toll of them. And so what research has discovered is that 1 out of every 3 of our defenders who have deployed into the war zone come back with either TBI or post-traumatic stress. And also with our first responders, where research shows that about 30% of our first responders are suffering with that. So there's definitely a great need out there. And when you look in the veterans community and the first responder community, and you see the rising homelessness rate, the substance abuse rate, certainly sadly, the increase in the number of suicides in those communities, it's very, very alarming. So the need is there to get after this. So through our great founder, Mr. Gary Sinise, who founded the Gary Sinise Foundation 10 years ago this year, we are teaming with 2 wonderful organizations, the Marcus Institute for Brain Health and Boulder Crest Foundation, to really try to get after these 2 very vexing invisible wounds in the TBI and post-traumatic stress.
I'm proud to announce the launch of the Gary Sinise Foundation Avalon Network, a new initiative that is part of our Relief and Resiliency program. This cognitive and mental health network will further expand our services to veterans and first responders struggling with post-traumatic stress, traumatic brain injuries, and substance abuse.
The challenge with invisible wounds, if you will, Kenyon, and I take this from one of my co-workers, Jim Ravella, says it better. When you suffer a physical wound, and we have many of our veterans who have suffered traumatic injuries physically, whether it's a loss of a limb, a variety of physical wounds. But the difference with invisible wounds is that they're contagious. And what I mean by that is that they are passed down to generations, whether it's to the spouse, to children. Children will pass it on to their children. And again, we see this dramatic rise in some of these issues that I talked about, homelessness and suicide and substance abuse. And so it's very, very important that we spend much more time and attention on that.
The Gary Sinise Foundation Avalon Network will empower veterans and first responders to cope with and overcome trauma, and in doing so, transform lives. In partnering with the Marcus Institute for Brain Health and Boulder Crest Foundation, we are deeply committed to seeing this new initiative build upon the Gary Sinise Foundation's long history of supporting the well-being of our nation's heroes, to bring essential relief and mitigate this epidemic.
The best thing that I could encourage your listeners and readers to do right now is go to the GarySiniseFoundation.org. It's a real nifty website, and it's very easy to navigate. And we have 4 programs, and one of the programs is called Relief and Resiliency. Click on programs and go to Relief and Resiliency, and it will walk you through what the Gary Sinise Foundation Avalon Network is all about. And one, if you're desiring to find more about it for yourself, great. Or 2, if you want to know how you can be part and contribute, it's very easy, and we solicit any support that you would feel inclined to do.